Hey, good afternoon, everyone, and welcome to today's webinar. I'm Donna Rice, the Chief Operations Officer for Diabetes Sisters, and many of you know that Diabetes Sisters is the only 501c3 dedicated to women with diabetes. We offer evidence-based peer support model that provides comprehensive education, monthly peer support groups, and a lot of resources where women can learn and share their experiences and challenges living and managing diabetes. Our lifestyle webinars are designed to provide the most updated information and education by experts in the field. We are pleased, so please, if you have any questions before or during the webinar, please type them into the Q&A and we'll address them after the talk. Today's webinar is on the behavior of medication taking. It's titled Understanding Your Medications. Our speaker, Staci Norman of PharmD, she'll discuss the basics of medication, the how-tos, the when-tos, and all the questions that occur when taking medications. So again, bring your questions and type them into the Q&A, and Staci will do her best to answer them at the end of the presentation. It is my pleasure to introduce Staci-Marie Norman. Staci's a pharmacist, PharmD, a certified diabetes care and education specialist for Martin's Pharmacy in Indiana. She received her Bachelor's of Science in Pharmacy from Purdue University and her Doctorate of Pharmacy from the University of Oklahoma. In 2000, Dr. Norman added to her credentials by becoming a certified diabetes care and education specialist. In 2022, she was awarded the Fellow of the American Pharmacist Association. She is a national faculty member for the American Pharmacy Association, and she teaches certified programs in both diabetes and cardiovascular disease. She serves on their advisory board that oversees the development and revision of these programs. Along with teaching and development responsibilities for APHA, Dr. Norman serves as a peer reviewer for research grants and publication submissions. She also sits on the board of directors for the Indiana Pharmacists Association as a district representative. Please help me welcome Staci Norman.
Thank you so much, Donna, for that lovely introduction, and welcome everyone. I hope that you find a few little gems out of today's program that you can use to make your medication taking a little bit easier and be able to find your way around medications a little easier. I've based a lot of this off of my experience in the pharmacy and talking with patients on a day-to-day basis. So a lot of what this is from is questions that I get from the pharmacy. So let's get going. And first of all, why are we having this discussion? We are having this discussion because medication taking can lead to issues if it's not done correctly. 60% of people over the age of 18 actually take at least one medication. And of those, only about 8.2% of them will report that they don't take their prescriptions because of cost. And I know with diabetes, a lot of our medications are very costly. And that's a major discussion I have with multiple patients every single day is what is the cost of the medication? How can we make it more affordable for them? And a lot of patients do end up saying, I just can't take that medication. And so then we have to start looking at different things. So cost can be a real problem. The other thing is that the more medications that we take or the more issues that we have that, that require medications, the likelihood that we don't take all of those medications becomes higher and higher. 20 to 30% of the prescriptions that are sent to the pharmacy are never filled. And that it can be for a lot of reasons. Cost can be one. Some can be just kind of a misunderstanding of why the medication should be taken. Not knowing it's even there is also something that I find surprising, but it can happen. So a lot of the prescriptions that just get sent in just never get filled, which can be a problem. With chronic conditions, we find that non-adherence to the medications becomes more problematic too. So if you're taking medications for diabetes or for high blood pressure or for cholesterol, the longer you're on those medications, sometimes that non-adherence does sneak in. And so anywhere between 30 and 50% of patients with chronic conditions can be non-adherent in some form. Why is this important? Well, when we don't take medications correctly, that can lead to emergency room visits. We don't want that. In the United States, according to the CDC, we have around 1.5 million emergency room visits because of adverse drug effects. And that can be anything from taking the medication incorrectly, either too much, too little, wrong time, with things that it shouldn't be taken with, drug interactions, especially if we have multiple drugs that we're using, those things can interact. And then allergic reactions can also be part of that. So understanding your medications and why you're taking them is very important so we can avoid that. Okay. So we're going to ask you to participate with a little bit of polling. And our first question today is, what is your biggest challenge with taking medications? And Donna's going to put a polling question up here, and we'll give you a few minutes to, whoop, it's up and gone. It's coming back, I'm sure.
Stacy, it should be up. Is it up?
It is not up.
Okay, hang on 1 second.
We love technology. It's always great. So be thinking about your biggest challenges. We'll have a few answers you can pick from.
Is it up?
Nope.
Okay, it worked earlier. Hang on.
There it is. So if you could just take a moment to click on what would be your biggest challenge, and we'll give a few moments to do that, and then we'll look at the results. So knowing how to take your medication or when to take your medication, side effects of those medications, cost, or if there's just something else that is problematic for you. Okay, let's see those results. Okay, cost. I'm not surprised that that is the one that has the most. That is the one question I field quite a bit. When to take it, or the side effects, and that can be very problematic for people. So we're going to hopefully answer all of these questions for you, or at least make it a little bit easier for you. Okay, moving on. So what should you know? I am always very surprised as a pharmacist that patients don't know the names of their medications or the strengths of the medication that they're taking, or what those medications are for. I get almost on a daily basis, I need to refill my little white pill or my little pink pill or the medication I take at bedtime, and they can't remember the name or things like that. So those things are really important to know, because you're going to have to give that list of medication to your doctor's office. If you go to multiple different doctors and have medications from different doctors, you need to make sure that you have a list of all of your medications so that they know what you're on. God forbid something happens and you end up in the emergency room. You need to be able to tell the physicians there at the emergency room what you're on and what you're taking. So I highly recommend to all of my patients that they make a list of their medications, what the name of the medication is, what the dose of the medication is, when they take that medication, and if they know what that medication is for, that too. So those all should be on that list. Keep that list in your purse, in your wallet, on your phone, in a note section, somewhere where you can get to it easily. And you can find a lot of that information right on the prescription label. There's a kind of an example of a prescription label here. These are the common things on. So the pharmacy name and number, the doctor's name will always be on there. There's always an RX number, which is a great thing for if you're reordering. But no, this is a little trick here. This lisinopril 10 milligrams, when this prescription runs out of refills, you're going to get a new prescription number. It's not going to be that same one. It has your name, how it's taken on it, how many, and then down at the bottom, it will have refills and when to discard that medication. And that becomes important. We'll talk about that when we talk about expiration dates. But those are the common things that can help you make that list up. So how is the medication taken? That's the other important thing to do. When's the best time to take it? You know, a good example is cholesterol medication, the statins. The best time to take those is at night. And the one reason why at night it's a good thing to take it is our body produces cholesterol overnight. So it's actually most active when the body needs it to be most active. So find out from either your physician or your pharmacist when the best time would be to take your medication. Take it with or without food. Some medications can cause a little stomach upset, and so taking it with food can help you avoid that side effect. But then there's other medications that bind up with food. I think of thyroid. That's the big one. If you take levothyroxine and you take it with food, you're not going to get much of that levothyroxine because it binds up with that food. So we have to take that one on an empty stomach. So knowing those things about your medication is really important. Taking your medication with a glass of water or with soda or those types of things can be an issue too. I'm thinking of one particular antibiotic, you take it with milk and you're not getting any of the antibiotic because it binds up with it. So you do need to ask those questions to make the most out of your medication. What should you avoid while taking medication? A lot of medications don't play nice with alcohol. So you might have to find out if you can have a glass of wine or beer on the weekend with different medications. Some medications make you more sensitive to the sun. So especially during the summer, you know, if you're taking certain medications, one diabetes medication would be those sulfonylureas. They make you a little more likely to burn. So finding those things out is important. Can you split or crush a medication is also important to know. One little trick with this is if it has a line down the center of the pill that looks like you can snap the pill in half, we call that a score. And if it has a score mark, you can break that in half. You can probably even crush it to be able to take it, because some pills are pretty big. They are a little harder to take, and that might make it easier to take. If your medication on the label ends with an ER or a DR, extended release or delayed release, those are not good medications typically to split or crush or chew. We don't want to do that because a lot of times they're coded to help with the delivery of the medication to be extended over time, or the pill itself is designed to release the medication slowly over time. And if you crush it or split it, it ruins that. And then you'd be getting all the medicine all at once. So we don't want to do that. So those are some hints to know whether you can manipulate those tablets or not. If you ever have a question, call your pharmacist. They can tell you one way or the other. The last thing, as far as your prescription, is keeping track of when you need more. So typically we do 30-day supplies or 90-day supplies. So either a month or 3 months. A lot of times, if you have a chronic medication, that blood pressure medication or the diabetes medication, and you're well controlled and that medicine is staying the same, a 90-day supply really does make sense. It less times to the pharmacy. A lot of times insurance gives you a better copay on a 90-day supply. But if you have a brand new medication, or you have your dose is changing because you're trying to find the right dose or get things under control, a 30-day supply is best. And that way you're not wasting money if the dose changes and that type of thing. Keep track of those refills. That's the last thing. You'll never have more than a year's worth of refills on any one prescription, because in every state, prescriptions are only good for a year from the date that they are prescribed. And then you'll need to get a whole new prescription. If it's a controlled substance, it could be less. So anywhere between 3 and 6 months, depending on the state you're in. So keep track of those refills. One thing I would recommend is, before you go to see your physician, take a moment, look at all of your prescriptions, see if you have any refills left, and ask for refills at the doctor's office when you go. Okay, administering medications. With diabetes, we have all sorts of ways of administering medicines. We have the oral medications where you just take with a little bit of water, but there are some oral medications that you can take that dissolve in your cheek or underneath your tongue. So make sure that you know if that is a type of medication that you are taking, because if you swallow it, it doesn't work as well. There's injectables for diabetes. Insulin. We all know that insulin has to be injected. Insulin can also be inhaled. So we have a rapid acting inhaled insulin, so a mealtime insulin that can be done that way. So I have some pictures here of different devices. So over here on the left-hand side of the screen, we have a vial and syringe, which is the typical older way of giving insulin. And then right beside it, here are examples of insulin pen devices. Now, I love insulin pen devices. I encourage all of my patients to use the pen devices because, first and foremost, they are more accurate than the syringe and vial. Syringe and vial, a lot of times it's hard to see where the lines are, or people get if they have any visual problems, that can be a real issue. Air bubbles in it. Not that the air bubbles will hurt you, because it's just going into subcutaneous tissue or that little layer right underneath the skin, but air bubbles take up medicine space, and so you might not get your whole dose. So vial and syringe is great if that is the only way that you are able to use the medication. But if you have the option for a pen device, it is a much nicer way of getting the medication. The other nice thing about the pen devices is if you have, if you're taking small amounts of insulin, the pen device has 300 units of insulin versus a vial that has 1,000 units of insulin in it. And once you puncture that vial of insulin, it's typically only good somewhere around 30 days. And so if you're only using 10 or 20 units per day, you're going to throw a lot of insulin away versus the pen device has 300 units in it. So you're more than likely going to use all of that insulin up before you have to throw that pen device away. The pen devices come in boxes of 5. So you get 1,500 units of insulin, but you can leave the pen devices in the refrigerator that are not open, and they're good until the expiration date on the box. So you're not wasting insulin. All right, the last way of getting insulin is through that inhaler. And so this is a picture of an insulin inhaler. This little capsule right here, this is where the insulin is. You put it into the inhaler and then you breathe it in. And so that is another option for how to get insulin. We also have insulin pumps. So this is a typical insulin pump with the infusion sets, and they also have cartridges that you fill with your insulin, which goes into the pump. So that is one way of getting insulin. This down here in the bottom right-hand corner is a pod pump. And so this you fill with the insulin and then put it onto either your upper arm or onto your stomach. And then using Bluetooth, you administer insulin when you need it. We also have injectable medications, the GLP-1s, so Victoza, Trulicity, Ozempic. Those are delivered via injection, and they are in pen form. And then the newer GLP-1 GIPs, so Mounjaro is our one that we have. Again, a pen device. And the Ozempic is very much like the insulin pens where you dial up the dose that you need. You use that pen for the whole month. And then the Mounjaro is very close to, well, it's the same pen device as like Trulicity. And it is preloaded. It has the pen needle and everything loaded onto it. Is one pen is one injection. And so once you do the injection, you throw the whole pen device away. So there's lots of different ways of these pen devices working. Speaking of pens, pen needles are important to go on either the insulin pens or some of the GLP-1s. And up here in this corner, I'm kind of covering it, so I don't know if you can see all of this, but there are different size pen needles, and typically we have in the past said longer ones are for people who are maybe a little bigger, and smaller ones are for those that are not as big. But what we have found is that's not really necessary, because we're putting the insulin or the GLP-1 or the GLP-1 GIP into subcutaneous tissue. And the layer of skin is the same layer no matter how big or small you are. And so the little small 5 millimeter, and there's actually a 4 millimeter now, are just fine for the majority of people, and they're more comfortable. So if you are still on the older, longer insulin needles, and you might want to try a smaller, newer, shorter, more comfortable needle, you talk to your physician or pharmacist, and I'm sure they can help you out with that. All righty, so it's time for another question. So, can you store your insulin at room temperature? And what is the expiration date of your insulin once it's open? So this is a twofer. So we're going to do poll number 2. We got poll number 1 up at the moment. So hold on just a moment and we'll get number 2 up. How are we coming, Donna?
Good. Okay, I'm going to share the results. Sorry.
Actually,
Just-
it never came up. Poll
Okay,
number 2 never came up.
I relaunched the poll and it blanked out. Hold on.
Okay, there's poll number 2. So we're
Sorry.
going to give you just a moment to throw in your answers real quick, and then Donna's going to show us those answers. Okay, do we have answers? All righty. So yes, we can store insulin outside at room temperature, and we'll talk about that a little bit. But it's perfectly fine to leave it in the refrigerator until you're ready to use it. And then expiration dates on insulin. And this was really kind of a trick question because it really depends on the insulin and the insulin device. As far as the length, it's good once it's open. So we'll talk about that a little more. Okay, moving on. Okay, so storage and safety tips for medication. With oral medications, storing in a cool, dry place is best. So I know a lot of us probably store them in the bathroom. It's a nice, fast way of when you're, your morning pills or your bedtime pills. But sometimes our bathrooms are not cool and dry. They can be hot and humid, especially after showers. So it might not be the best place. Kitchens are also a lot of times places people store it if it's near the stove where it can be more humid and hot. That's probably not a great place. I've seen in kitchen windows, that's where my grandmother loved to store hers. Not a great place. On that kitchen windowsill above the sink, humid, light exposure, not a great place. So cool, dry, darker place up out of the hands of, out of the reach of little ones is also a good thing. Injectable medications. With insulins, GLP-1s, GLP-1, GIPs, they are refrigerated. And when you get them home from the pharmacy, put them in the refrigerator. Now, once you open them, they can be outside of the refrigerator for a period of time. You need to find out your insulin, the device it's in, if it is 10 days, 14 days, 30 days. There's one insulin that's 42 days. So you need to find out what that expiration date is once you open up either that pen needle for the first time or pen device for the first time or the vial for the first time. Multi-dose vials. So an insulin vial is multi-dose. So once you put a needle into that very first time, typically it's about 30 days until you need to throw it away. And it can be left outside of the refrigerator for that whole 30 days. But whether you leave it outside the refrigerator or in the refrigerator, 30 days after you've put that first needle in it. The pen devices, again, it really depends on the device and the type of insulin or GLP-1 that you're using as far as how long it's good. If it has not been opened, it's as good until the date on the box. But once you open it, it typically is anywhere from 10 to 28 days. So find out from your pharmacist how long that is once it is good. So those pen needles, remember I said the box of 5? Put that whole box of 5 in the refrigerator and just use one pen at a time. Take that one pen out, use it until it's gone, leave it outside of the refrigerator, because if you, with the pen needles or with the pen devices for insulin, if they're going back and forth, back and forth, back and forth, sometimes that can upset the pressurization in it, and that can affect the dose. So once you start using that pen needle or pen device for insulin, leave it out. It's typically anywhere between, again, 10 and 30 days, depending on the insulin and the device. So find that out. Okay. Expiration dates. We give oral medications 1 year from the date it's dispensed. That's because we don't know what the environment is going to be that those medications are in once they leave the pharmacy. So what the medication says on the bottle in the pharmacy might be 2 or 3 or 4 years before it expires. Once it leaves the pharmacy, we give it 1 year. And that's just to be overly cautious, to make sure that you're getting medication that still is very effective. Most medications lose effectiveness over time, but some medications can actually become toxic. A good example is a antibiotic, tetracycline. If you have that sitting around for a year or two, it's not good. It can be very bad. So we don't want you taking things that could actually hurt you. So we give it a 1 year expiration. Again, injectables that have not been opened and are in the refrigerator, it's stored like they come from the manufacturer. Those are good until the date on the box. But once you open it, it depends on the medication and the device. One thing that I get asked all the time, every single time I'm working in the pharmacy, someone will call and say, I have these medications that are left over. What do I do with them? How do I get rid of them? And so there are DEA drug drop days. You can get on the DEA website and it will tell you what those days are, where the drops are. Typically, it's fire stations or police stations that that you'll be able to drop those drugs off at. We actually have a DEA drug drop box outside of our pharmacy, so you can come and put the medications into that, and then we get rid of those medications and send those to the DEA to be disposed of. So that might be an option with a pharmacy in your area. If you don't have either of those things, if you go to the DEA website, they have a flush or no flush list. So some medications you can actually put down your toilet and get rid of them. If they're not on that flush list, you can combine the medications with either kitty litter or coffee grounds or DEA says dirt, anything that people will not want to put in their mouth, and put those into a Ziploc bag and throw it away in your trash. So there are options for getting rid of medications if you don't have a drop box or a DEA drop day in your area. There's also medication disposal kits. I went on Amazon, put medication disposal kits in, about 6 different kits came up that you can order. It combines with the medication and you can throw it away. So there are options out there. Okay. So our last polling question, What is the cardinal sin of traveling with medications? So is it packing it in a checked bag, forgetting to bring it, not packing enough, not bringing backups, or all of the above? I'll give you a moment. All right, all of the above. And packing it in a checked bag. You are all very, very smart. Actually, my number one rule is if you are flying or if you're handing over your luggage to anyone, you do not pack your medications in that. I have a very good example. My father, we were taking him to Lourdes, France to dip him in the holy water because he was having some issues. And he had all sorts of medications to keep him breathing. And he packed them in his checked bags. And 24 hours after we had arrived in France, he still did not have his checked bag or his medicines. Not a good thing when you're needing those medications to keep breathing easily. So never, ever, ever put it in a checked bag. It always goes with you in your carry-on luggage. And I have patients that say, well, I don't know, my insulin and my needles, and I don't know how that will work through TSA. I travel all over to do classes. I have a pack of insulin syringes, pen needles, pen devices, insulin pumps, all in my carry-on. I've never been stopped by TSA. They really do know the different medication devices that are out there. So don't be worried about that when you're traveling. Traveling with refrigerated medication. So a lot of the medications are okay out of the refrigerator for probably the length of time of a typical 1 to 2 week trip. But if you're taking that trip around the world and it's going to be, 40, 50 days, probably none of those refrigerated things would make it that long. So you might need a refrigerated travel cooler. Again, Amazon. About 6 of them came up right away when I put in travel cooler, refrigerated travel cooler. And some were small enough to fit into my purse. So there's lots of different options out there. Hotels also, if you call ahead, you can find out if there are refrigerators in the room, or they will make accommodations for you if you tell them you have refrigerated medications. Scheduling, trying to keep on that schedule while you're traveling is also really important. It can be a little tricky, especially if you're going through multiple time zones or transcontinental. It can be a little more tricky. What I would recommend is before you leave, kind of map it out. And know when those time changes are going to be, when you should take that medication to kind of keep you on time and then get you into the time frame that you're in once you're at your location. Take a few minutes, plan ahead. It makes it a lot easier. And then make sure you're taking enough medication to last. If you have a vacation that's coming up and you are going to need medication refilled, but maybe it's a little too early to refill it, work with your pharmacist, because a lot of times there's vacation overrides that can get you an early refill. What your pharmacist is going to need, because the insurance company will ask, and I know this from experience, is when you're leaving, when you're getting back, and a lot of times where you're going. So let your pharmacist know that, and they can help to get those overrides. And don't forget to pack extra supplies, extra pen needles, extra pump supplies that you might need while you're gone. Okay, medication costs. This is the thing that everybody has an issue with at some point or other. There's always some medications that are going to be more expensive. So brand name, newer medications are going to be expensive. And we know that with diabetes. You know, our insulins are really expensive. The GLP-1s are really expensive. The SGLT2s are really expensive. So it can be very costly very quickly. But in some of the drug classes, there might be a generic available. And the longer things are out, the more generics become available. So those might be more cost effective for you. Insurance might prefer one specific medication in a drug family versus another. So like in the GLP-1s, we have Ozempic, Victoza, Trulicity, Byetta. All of those, an insurance might pick one that's the one that they will pay for. So you need to find that out from your insurance company. Go with their formulary if it works. If it doesn't work, maybe a prior authorization is going to be needed. I deal with prior authorizations every single day. So the doctor sends in a prescription, we send the prescription to the insurance company to get paid, and it comes back rejected, needs a prior authorization. So the whole thing with prior authorizations is the pharmacy then sends that information to the doctor's office. The doctor then answers all the questions that the insurance needs to know why they're wanting that medication. Maybe you've tried everything else in that drug class, and that's what the doctor wants. Or maybe you've had a reaction to something else that the insurance wants to pay for, and you don't have an issue with this. So those are the types of things that the doctor has to answer. The insurance has to say then yes or no. And if they say no, you can always appeal. So it might take a little while. Prior authorizations can be as quick as a few hours. They can take a few days. So just be patient, but that process can work through. You can talk to your doctor's office, see where they are in the process. You can also talk to your insurance, see where they are in the process, and work on getting that taken care of for yourself. Manufacturer drug coupon programs are also very helpful. They can lower your costs. So what happens is the insurance says they'll pay this much, and then the coupon then helps your copay to become lower. So a lot of those coupons will say as low as $25 per month or as low as $0 per month. There is a catch. They typically have a max amount that they will pay. So some of our more expensive medications are, $1,000 a month. Maybe your insurance brings your copay down to $600 a month. And then you have this insurance card that says it will pay on it, and it could be as low as $25 a month. But you get to the pharmacy and it's $400 a month. That's because that coupon card in the tiny print probably says max $200 a month benefit. So you do have to look at the tiny print on those coupon cards to know exactly what they are going to do for you with your insurance. The other thing with the coupon cards is if you have Medicare or Medicaid as your insurance program, you cannot use the manufacturer coupon cards. It's something in the laws with Medicaid and Medicare and government insurance programs. But there are manufacturer patient assistant programs that are available for those with Medicaid, Medicare. They're based on income that you can apply for. There are drug discount programs like GoodRx, ScriptSave, Blink. Typically, these are very helpful with generics, bringing down the cost of that generic even further if your insurance isn't helping with it. When it's brand name, they can maybe help a little, but usually not very much, but they can be helpful. And then finding medication has been a real issue. If you've had a GLP-1 or Mounjaro that you're trying to get a hold of, you know, you might have to be calling around to the pharmacies. So to find out who has it, it is getting better. I can tell you that it is getting better. It is more well stocked in the pharmacies, but still can be an issue. There are programs though that can help you. Prescription Quest is one of those that you can work with them. They actually call the pharmacies for you instead of you calling around. So there are things out there that can be helpful. Okay. And kind of last but not least, these are questions for you to ask either your doctor or your pharmacist to get the most out of your medications. Why am I taking this medication? What type of result can I expect from that medication? You know, I'm taking this to lower my blood sugar. Am I going to start seeing results right away? Or is it going to take a few weeks before I start seeing changes in my blood sugar? Those are the types of things that you need to be asking. When and how should I take it? So, you know, if it says every 4 hours, I'm supposed to take this medication. Well, that could be in the middle of the night. Do I need to really get up in the middle of the night? So those are questions that you can talk with your physician or your pharmacist and best figure out the schedule for that. Do you take it with water, milk, soda, coffee? What's the best way of taking it? Again, we don't want that binding up of things. Some medications need to be taken with carbonation to help get them going a little bit better. So find out those types of things. We talked about eating or not eating foods with medication. Possible side effects. Is it going to make me drowsy? Is it going to upset my stomach? With diabetes medications, is it going to give me severe hypoglycemia? What types of things do I need to be looking for typically? What should I avoid? Should I avoid the sun? Should I avoid alcohol? Should I avoid certain foods with this medication? And then interactions with other medicines. And don't forget over-the-counter or supplements. A lot of the natural products can interact because, you know, a lot of our medications come from natural products. And so, you know, there are certain natural products that have qualities like antidepressants or like statins. And so they could interact with medications. So make sure you're letting your doctor and pharmacist know what you're taking over the counter or as supplements. Moving forward, I hope that you've enjoyed today and that you've learned a little bit and have some new things to add to your arsenal. But there are other places that you can learn more about diabetes. Obviously, there are meetups with the Diabetes Sisters. And if you go to diabetessisters.org, there are lots of different resources for you. I know I just wrote some articles on insulin that you can find in there. But also the American Diabetes Association has really good information. And if you just look online, there's lots of different online forums for diabetes management. So always, I tell my patients, get as much education and knowledge because that's really your best weapon for making sure you're keeping yourself healthy and living long and strong with diabetes. So with that, I'm going to turn it over to Donna and we're going to take questions.
Thank you. Thank you, Stacy, for your great presentation. We have a few minutes and I see that there's quite a few questions that I'm going to pull up now. And the first question comes from, it's an anonymous attendee and it says, does taking a fiber supplement interfere with metformin or Zetia, and does timing make a difference?
So timing really does make a difference with fiber because really with any medication and fiber, you should time it away. So either take your medication 20 to 30 minutes before you take your fiber supplement, or wait an hour to 2 hours after the fiber supplement to take those medications, because fiber likes to bind everything. So try to avoid taking your medicine with your fiber.
Great. The next question comes from a Jane, and it says, what do I do if I miss a dose? Doesn't say what kind of medication, just if she missed a dose.
Okay, so with missing doses, typically, if you're within an hour to 2 hours of when you normally take that dose, you go ahead and take the dose. But if we're getting outside of that, we need to look at when is your next dose. You don't want to get doses too close to each other, because then you can have over medication that can occur. So it really does depend on the medication and the timing of your doses as far as if you can take it or not. So if you're within that hour to 2 hours of a normal dose, almost all the time, you can just take your dose. If you're outside of that, a lot of times we just say skip the dose and get back on track with your next one.
Good. Okay, the next question comes from an anonymous attendee. Can you just stop taking a GLP-1, or do you need to wean off of it? I have so much trouble getting my script. Is it worth it? Question mark. Not really working for me anyway. So there's several sentiments in this. Yeah.
So no, you do not have to wean off of a GLP-1. And the one thing about the GLP-1s is they are so long acting that they are going to stay in your system for a while, and they kind of naturally wean themselves off. Now, where you're going to have an issue is if you're having a hard time getting the GLP-1 and it's been, over a month. Unfortunately, a lot of people have to start back over at the low dose and then work themselves up. Thankfully, we are seeing that we're getting medication a little more regularly. I was just in the pharmacy on Saturday, and we had all but 1 or 2 doses of Mounjaro. We have all of the Ozempics. We have all of the Wegovy's. So we're getting things a lot easier now as they've ramped up production. So hopefully that won't be an issue for too much longer. So hopefully that answered your question.
Good. Okay, thanks. We have a question. I've been taking a statin for years, prescribed by my doctor. This is the first time that I've ever heard that I should be taking it at night. Who in my care team should have let me know that taking it at night is the correct time? Just want to know for future medicines that I might be prescribed.
Okay, so with that, at night is really the best. But what I will say is Lipitor and Crestor, so atorvastatin and rosuvastatin, those are our newest statins. They are not as time dependent as our older statin medications, and because they have a little longer length of action. So if you're taking those two and weren't told to take it at bedtime, that's the reason why, is because they aren't quite as dependent. With the older statins, we would tell everybody to take them at bedtime. And so because of when cholesterol is made. So it's not really a lapse in if somebody should have told you or not told you if it's one of those two particular statins. But my thought is I want my medicine to be working at the best time. So at night would be the best.
Okay. And the last question, I want to definitely answer this. I've been taking Prandin for over 20 years. It seems to be less effective lately. Is that known to occur?
Yes, it's known to occur. Unfortunately, diabetes is a progressive disease. And what Prandin is doing is it's squeezing your pancreas to produce a little more insulin to help with that sugar that's coming from the food that you're eating. Because it's a progressive disease, we don't make as much insulin over time. And so that Prandin is having a harder time doing its job. So probably it's time to be talking to your doctor about alternate therapies.
Good. Okay. Thank you all for your questions. We're about out of time. I just want to thank Staci for her knowledge and her wonderful presentation. And remember, Staci's written 3 articles on insulin that was debuted in our most recent newsletter. So please take a look at it and take time to read it. It's extremely in-depth and comprehensive, everything you need to know about insulin. We also have a great medication tip sheet that complements this presentation, and it's available at our website for download. So again, a big thank you to Staci. It's been a great meeting. Thank you all for joining. Bye, everyone.